Disease surveillance is the continuous systematic collection, analysis, and interpretation of health-related data needed for planning, implementation, and evaluation of public health practice. It is a critical component of public health infrastructure, enabling early detection and response to disease outbreaks, and ultimately protecting communities from infectious diseases. Nigeria's preparedness and response mechanism to disease outbreaks, a case of metapneumovirus, which broke in 2001 in the Netherlands and now traces in China. Should there be an emergence of this virus in Nigeria, containment is a focus on this segment. And my guest, Dr. Tochi Okwor, Acting Head, Department of Disease Prevention and Health Promotion, NCDC, will speak to us. Dr. Tochi, thank you so much for joining us on Insights.
Thank you for having me.
Thank you very much. Now, could you explain to us how this virus works, and is it different from COVID-19?
The viruses cause different types of diseases, but with respect to the type of illness it causes, it could be said to be similar to COVID-19, because both of them cause what we call respiratory illnesses. And the symptoms of these respiratory illness is basically the symptoms of the common cold. The stuffy nose, the fever, person runs temperature, coughing, sneezing. And then in severe cases, particularly in individuals with low immune system, in the very young and in the very elderly, it can become severe in some cases.
Okay, so what is the mode of transmission? How is this transmitted?
So the mode of transmission is, because it is a respiratory illness, it makes people to sneeze, to cough. So in the process of sneezing and coughing, individuals will then bring out particles, what we call respiratory particles. And within those respiratory particles will be the organisms, in this case, the virus that causes the infection. And it then means that as it's out there in the air, floating, if you're very close to an individual that is bringing out such respiratory particles carrying these viruses, and it falls on the faces, perhaps the nose, what we call the mucous membranes of the nose, the mouth, even on the mucous membranes of the eyes, these viruses would then be deposited there, and then they can move on to cause infection in vulnerable people. In the same vein, as individuals are sneezing and coughing and not taking the appropriate respiratory hygiene and cough etiquette that we say people should take, these particles containing viruses, containing the microorganisms that cause infection, will fall on horizontal surfaces. And then if we also use our mouth and to cover our noses while we are sneezing or coughing, we can touch surfaces, perhaps door handles, light bulbs. That is why keeping the environment clean, doing hand hygiene and respiratory hygiene and cough etiquette are very, very critical, not only for this human metapneumovirus, but indeed for every respiratory illness. It is standard practice that we are careful how we take care of our sneeze and our cough.
What are the risk factors?
Well, the risk factors, I'll first of all say that these things, these common colds, they're seasonal.
Okay.
And in some parts of the world, they're common during, for instance, winter. And then if you come to the human beings that are predisposed, I have mentioned that the body has a way of taking care of infections. But then you have sometimes when some people are more vulnerable, the very young, whose immune system has not developed adequately yet to be very robust to the extent to handle this. So the very young, you also have the very old, maybe more vulnerable. If you have individuals who, for one reason or the other, for reasons of other illnesses or some treatment they're taking, they may become more vulnerable. Asthmatics also may become more predisposed to developing severe cases of some of these respiratory illnesses.
You earlier mentioned vulnerable persons. Now let's leave out the children and the aged. Now for somebody with cancer or HIV, how high is the risk?
You know, when individuals have cancers and are receiving cancer therapy, often it impacts their immune system, and their immune system may not be as robust as we would like it to be to fight infections. And therefore, it predisposes them to more severe infections, not only for these respiratory illnesses that we're talking about, for generally all sorts of illnesses. And that is why we pay very close attention in the hospital environment where individuals receiving cancer treatment are treated. We place them in what we call protective we do use protective mechanisms and really hype up infection prevention and control in such settings to continue to reduce their vulnerability to these.
Now, should there be a trace of these symptoms you've mentioned, what should be the next step? Isolation or primary care?
I'd like to state that it is standard practice that when any individual has signs and symptoms of the common cold, it is important that such individual takes care not to move in or at least removes himself from circumstances where other people may be disposed. Therefore, when we have a common cold, we have to practice what we call respiratory hygiene and cough etiquette. That means that anytime you want to sneeze or cough, it is important that you cover the mouth and the nose. You can use the crook of the elbow to do that, or you can use a clean tissue to cover the mouth and the nose, and immediately after sneezing or coughing, ensure that such tissue is properly disposed of. And remember, I had mentioned that the hands can also move these around. Therefore, hand hygiene, washing the hands with soap and water, running water, using the appropriate step becomes important. Also, when we have the common cold, it is important, in the common cold and other respiratory signs and symptoms, it will be better not to get into crowded places. That would be the best time to perhaps take some time off from the usual interaction with other people until we recover, to reduce the risk of spreading this from person to person. And it's also important to take care of the environment. These particles containing the organisms causing the infection can fall on surfaces. So taking care of the environmental surfaces, cleaning them with soap and water, paying attention to the door handles and the frequently touched surfaces of not only our homes, frequently touched surfaces, even in places of work, frequently touched surfaces in hospitals become very important, that attention is paid to them.
Of course. Now, before we talk about Nigeria's response mechanism to disease outbreaks, our surveillance, what role does diet play in treatment?
Diet is very important because the body has what we call the immune system. And the immune system is really what takes care of numerous encounters the body comes in contact with on a daily basis of organisms that have the capacity to cause infection. But diet, a well-balanced diet, helps to boost our immune system so the body can put up a good fight. So often our body does these things without even us knowing that our body has been at war with these disease-causing organisms. So it is usually those ones that that the body is not able to take care of fully, that we even begin to see that will come out as signs and symptoms of infection. And so a well-balanced diet gives us a very good fighting chance to take care of these organisms. It also ensures that even if we have symptoms, that we will not get into very severe symptoms. So diet is very critical for fighting every form of disease.
For fighting every form of disease. Okay, now let's talk about disease response. What is it like in Nigeria in terms of surveillance?
Okay, so Nigeria has a surveillance system. It is part of the work that at the NCDC, the National Public Health Institute, does in collaboration with all the relevant agencies and partners. So on a daily basis, there's a whole system in place to continue to keep watch over the country, to pick out when things are going wrong. That would be the simple way I will put it. There are some diseases that we know we run the risk of on a regular basis, and through our disease surveillance and notification system, we have put in place mechanisms to, on a daily basis, continue to watch for those things. But we're also mindful that there may be situations where some things we are not watching for, some new circumstances may arise that will demand that we also do surveillance. And that is where we have pillars in place. We have mechanisms where if we get alerts going on in other parts of the world, we have a system in place where we can quickly do what we call a dynamic risk assessment. And what that means is that we quickly assess the situation by pulling together experts, looking around what is happening around the world, and using it to begin to get some idea of the risk we run as a country. And using that dynamic risk assessment, we can then begin to put in place actions, mechanisms, approaches to ensure that we continue to keep Nigerians safe and continue to plan for whatever needs to be planned for, given what our risk assessment has informed us.
Okay. Would you like to mention some of the mechanisms? Would you like to highlight them first?
Yes. Some of the mechanisms will be, first of all, as we are currently doing, we want to continue to bring to Nigerians the right type of information to allay anxiety and make sure that everybody understands the state of affairs as much as we know them. And then to bring to everybody's attention those actions that can be taken as prevention. Because at the end of the day, it is individuals in Nigeria who would need to do the needful in the form of prevention. So we bring all that information out there. We also then make sure that we beef up the surveillance system to enhance it so that it becomes a little bit more sensitive to pick out whatever we are looking for in case it arrives in the country. And one of the ways we do that is to ensure that we enhance our laboratory capacity. Nigeria, through our public health lab system and national reference lab system, we constantly are working to ensure that we have the capacity to detect these organisms of interest, both the ones you're observing routinely, but also that we continue to work on our capacity to quickly develop whatever needs to develop in terms of capacity and scope and scale to pick up in case there's any new thing we need to be looking out for. So those are some of the ways we do that. We also collaborate with different agencies to bring in their expertise, and then we address this as one country.
What about the airport and our borders?
Nigeria has a good port health services system that's there, and we all work in collaboration at the national level. And there are really expertise at that level of the port health system where they also use a risk-based approach to constantly assess the situation, understand the country's level of risk, and following their frameworks, their standard operating procedures, they responsibly activate whatever needs to be activated at whatever level of risk the country anticipates it is. So it is a really well thought out thing that happens all the time based on a risk assessment and with all the experts coming together to inform what goes on an ongoing basis.
Okay. With porous borders, you know, people just strolling in and out of countries, but the border is an important place. That point of entry is very important. What is NSCDC doing at the borders?
There's an organized approach to this, but basically it is the remit of the Port Health Services, and we're all working in collaboration, coming together, assessing the risks, and then all the relevant departments of government then go ahead to activate or tighten whatever needs to be activated or tightened. But currently there are no known vaccinations, but efforts are underway to quickly come up with vaccines. You know, this is really not a local problem. It's the whole world is working together.
All right. Now, as a medical practitioner, give us final tips to staying healthy generally.
Prevention is really, really very important. And keeping the hands clean, as simple as that sounds, is critical because it is hands that will pick up something from one part of the body, from one part of Nigeria to you, to the vulnerable part of the individual. I'll also like to emphasize that we really need to pay attention to our school health services. School health, let's catch them young. Let us give our young ones the proper health education. So communal hygiene, environmental hygiene, personal hygiene, and then in the hospitals, must continue to make sure that we have well and robust infection prevention and control practices to keep not only health workers safe, but also to keep the individuals and communities that these hospitals serve safe.
Dr. Tochi Okwor, I want to thank you so much for joining us on Insight this week. Thank you for enlightening us. Thank you very much.
Thank you.
What are we doing as a nation to, first of all, settle our teeming populace, especially the
NTA's political package with a third eye on the nation's political scene. I am Fisa Ogunfuyi. Welcome.
You have to be very careful giving space to people who are obviously sponsored to further the agenda of some other groups.
There's a lot of questions. A lot of questions in a closed door sessions. Some of these issues, some of the problems bedeviling of their.
In fact, between June 1st and July 17, 19-point-something billion has left the coffers of the NDDC.
I can say my constituency, they need everything because we don't have anything.
And that's it on Insight for this week. But just before we go, our call to action. We've talked a lot about a number of issues on Nigeria's mining sector, from bridging the gap, between natural endowments and boosting our capacity for exploitation. And one thing stands clear in all of the issues that we've talked about, and that is the pressing need for collective action. This action must give priority to transparency. It must give priority to accountability and sustainability in the sector, while also ensuring that Nigeria's fiscal and non-fiscal incentives align with global best practices and that they support the country's development goals. Policies must align with political will and the desire to succeed if we must unlock the full potential of Nigeria's mining sector and drive economic growth, revenue generation, and sustainable development for the benefit of all Nigerians. That's a call to action. Join us same time for more on Insight. Of course, that will be next week. My name is Nnamdi Odipo.
And I'm Elizabeth Omori. We'll see you next week. Stay safe.